Most parents worry about their children's ailments in the first few years, but what one has to understand is babies or children's immunity is immature in the first 2 to 3 years. As a rule of thumb, a child is allowed to have 4 to 6 minor infections in the first 2 years of life. General minor infections are common cold or sometimes vomiting and loose motions, which can happen when the child starts teething. Generally, most babies get colds and coughs in the winter and vomiting and loose motions in the summer.
It's a very common problem. It's cold cough. So generally we जब weather changes में हम लोग थोड़ा कोशिश करते हैं कि बच्चे थोड़ा full टी-शर्ट और जैकेट वगैरह पहन के and उसमें मतलब I heard कि तुलसी का पानी देने से अच्छा होता है, बच्चों का थोड़ा immunity strong मतलब अच्छी होती है और च्यवनप्राश देने से ऐसा रहता है. अदरक को कस के और उसमें हनी हम लोग मिला के वो बच्चों को रात में सोने से पहले दो that's good. थोड़ा steam करने से it's good for the kids.
First 2 years of life, there is evidence that if you give vitamin D drops regularly, it prevents a lot of infections because vitamin D helps immunity. And throughout the world, now the recommendation is to give vitamin D drops for all babies in the first 2 years of life. Generally, the bacteria which causes vomiting and loose motions in children are there in all the surfaces, especially in summer. And if a child touches those surfaces and puts their hand in the mouth, they are more prone to get vomiting and loose motions. So to prevent these infections, parents need to avoid dirty surfaces, clean the surfaces clean, and also avoid children touching those surfaces and putting their hands in the mouth, which will avoid a lot of vomiting and loose motions, especially in the summer months.
The common ailments that I had to deal with her were a runny nose, cough and cold. Cough and cold, not as much as a runny nose. So the basic precaution that I always took with her was that I made sure that I was steaming my baby before I would put her to sleep.
The common question which worries most parents, when do I visit the doctor? The answer to that, I always tell them, is if your child does not look as usual, you should head to see a doctor, especially in the first 2 years of life. As a rule of thumb, a child is always active unless they are sleeping. So if a child is not active, or they are refusing feeds, or not able to eat, or if they are throwing up, there is something wrong with the baby. So if a baby is not well, or if the baby has got a fever, or if they are throwing up, we need to head to the doctor.